Okay, I think unless somebody tells me otherwise, we should probably make a start. Is that okay, Meg and Anu? Okay. Apologies first if anyone's had trouble getting in. Some of us have had some Zoom link issues. Hopefully they've been resolved, and certainly we seem to have got a good audience coming in now. My name's Ian Gilmore, and I am the chair of the Alcohol Health Alliance, and this is one of our AHA seminars, and I'm delighted today that we've got Professor Eileen Kaner to talk to us about the evidence regarding minimum unit price from their work in Scotland. Most of you will know Eileen, but she's the director of the North East and North Cumbrian Applied Research Centre. She's an NIHR senior investigator and a professor of public health in the University of Newcastle. She's also an old friend, and I mean that in the nicest way, Eileen. You're very well placed at the border in Newcastle to do these comparisons. And I know you've been working with another old friend, Peter Anderson, on this, and we look forward to hearing what you have to say and to fielding some questions at the end. So over to you, Eileen.
Perfect. Thank you, Ian. I'm going to just go through the initial hurdle of sharing slides and making sure that you can all see them. I appreciate...
While you're doing that, Eileen, can I just check with Meg and Anu, do people know how to submit questions? Is to do it through the chat? Is that right?
Yeah, if you have any questions, just put it in the chat with your name and your organisation, and then at the end we'll have time to go through some of them.
Fine. Okay, back to you, Eileen.
And Meg, can you see my slides as they need to be seen?
I can see the next slide.
All right, I just need to do that again. And tell me now.
Yeah, that's perfect.
Perfect. Well, thank you, everybody. I'm delighted to be here on a sunny afternoon from Northumberland. And I'm going to be talking about minimum unit price. We'll be looking at some evidence from Scotland and also from Wales. And I'll begin by essentially saying that I'm standing on the shoulders of giants. For those of you who know me, I'm pretty short. So I think I mean that literally as well as figuratively. And I'm really speaking here on behalf of a wider team. And that would include my colleagues, Professor Peter Anderson, Amy O'Donnell, who's in Newcastle with me, Jürgen Riem, Jacob Manthe, and also Eva Janet Lopez. I'm going to begin. I've got a cartoon or a visual here that Ian, I think, will remember from a long way back. This is a little bit of personal context, and it's essentially my rider for the talk to come, in the sense that I'm not a technical expert here in terms of the statistical analysis. My background, as Ian has said, is specifically around public health and primary care research, and most of my own work has been focused around secondary preventive interventions, particularly brief interventions, looking to reduce alcohol consumption and alcohol risk in higher at-risk groups. And my journey with minimum unit price arose essentially from chairing NICE guidance. And our guidance, which was called NICE PH24, was actually published in 2010, although it was 2 years in the development. And we were looking here at the prevention of alcohol use disorders in adults and in adolescents. And what was quite unique about this guidance is that it focused on policy level interventions as well as health service or health system interventions. And a lot of the evidence that we looked at as part of a NICE program development group focused on modelling work around the policy level interventions. For price, we looked through data that showed relationships between price level changes and behavioural responses. And a lot of this work was used to form the basis of modelling work where key parameters were adjusted to predict the likely size of effects. I think this is an alcohol aware audience, but before I go further, I just wanted to focus a little bit on alcohol prevention and look at the alcohol harm paradox. And as many of us would know, people who've got the most intensive needs relating to their alcohol consumption, people who may be dependent on alcohol, sometimes called alcoholics, they're relatively small in number in our population, but they each have very intensive needs for support and care from the the health system. The group of people we call heavy drinkers, this is about a fifth of the population, although where I sit in Newcastle, it's closer to a third of the population. And here we individuals who are heavy drinkers or hazardous and harmful drinkers, sometimes they're called, they sit on a continuum of consumption. And each individual in this group has fewer problems than those in the above group of people who are dependent on alcohol. But the sheer size of this group means that it contributes the most impact in terms of the NHS, but also wider statutory health and care systems, and also for the country and the economy. So from a public health perspective, this is where we can often make the biggest impact if we tackle higher risk drinking in this large group. It's sometimes overlooked that the majority of people in the population are moderate drinkers, drinking within recommended low risk consumption guidelines. And this is a very sort of big group. Most people do not experience alcohol-related problems. Nevertheless, sometimes occasional sort of binges or other life circumstances can cause problems. So we need to just keep an eye on this group. And then the non-drinking group is hard to quantify because, and this is quite a complex group. It can include a mixture of people who've never drunk for cultural and for other reasons, people who've chosen to not drink for lifestyle and a variety of reasons, but also people who've experienced the highest degrees of dependence, but who've had to stop their alcohol consumption because of health and other problems. And so as I've said, we can make the biggest impact by focusing not on the alcohol dependent group, but by looking across the population and trying to address problems across the entire population. And so prevention requires upstream work and also some targeted work to support people with most intensive needs. And for full population impact, we need to attend to both, but often you can have the biggest bang for buck if you are thinking about trying to look at upstream interventions that we can apply. And indeed, there's also an argument there to try to help individuals from developing problems before those problems arise. So looking at the NICE guidance, it seems a long way back now, it's 12 years ago. What did we recommend in terms of those policy recommendations? The guidance recommended considering introducing a minimum unit price for alcohol and regularly reviewing what that minimum unit price level was. It also suggested considering reviewing alcohol duties to support minimum unit price. There are recommendations around advertising and promotion of alcohol products, particularly thinking about younger individuals who might be exposed to those promotions. And also we made recommendations around the availability of alcohol to the population and also the density of outlets that are available to sell alcohol. And for the rest of this talk, I'm going to focus very much on price-based considerations and minimum unit price in particular. So what is minimum unit pricing? I feel in this audience I might be teaching my grandmother to suck eggs, but essentially it is a floor price beneath which alcohol cannot legally be sold, and it's based on the amount of alcohol in a product, the alcohol by volume or ABV, and this is often measured in grams. It is designed to be a targeted measure, and it has a specific focus on stronger alcohol products that can be sold at low prices, particularly in the off-trade and in supermarkets, where it can be used as a loss leader. And there's a very nice paper by Wardle and Chang, who are based in Australia, who've actually done some work on this particular issue of alcohol being sold below cost price, but as a means of for supermarkets of essentially drawing people into those premises, and when they're there, they will buy other products. And I've put this diagram of standard drink units up to remind me that the amount of alcohol in a standard drink unit can vary from country to country. In England, and Scotland and Wales, we tend to think of this as 8 grams of alcohol, or 10 mils, but in the Republic of Ireland, and I'll mention that in a moment, it's 10 grams of alcohol. So where we're looking internationally, we have to keep a focus on how much alcohol is in a standard drink unit. And back to NICE, when we were considering evidence looking at price-based policy recommendations, there was a lot of evidence at that time. Looking at the papers at the left of this table, these papers included, you know, up to 132 studies, and these were studies that were particularly looking at the relationship between how much alcohol products cost and the level of demand that there was in people to buy these products for consumption, depending on the level at which they are priced. And we talk about this relationship in terms of being an elasticity or an inelasticity. And essentially, this is just a mathematical way of trying to capture a percentage change in demand for a product with alcohol in it, divided by the amount of change in its price. And price can go up and it can go down. And the elasticity figure just captures that relationship. And the inelasticities themselves can seem a little bit abstract. So I've put this slide up here just to help us understand how those sorts of figures get converted into behaviour change. And I've taken the figures from Huang, which was government-based work in the previous slide. And these are the UK inelasticities that they presented from their work. And if there was a 10% increase in price, you would expect the percentage changes below to represent the difference in demand for these sorts of products. And elasticity of below 1 suggests that there's a relatively small reduction in demand for a given price increase. And things, if you wear hair bubbles like I sometimes do, elastics can be more stretchy or less stretchy, depending on you know, how old they are, etc. But for here, people have got different relationships to alcohol depending on you know, what place it features in their life, whether they identify with certain products, etc. And so people have got different degrees that they would actually change their behaviour depending on the price that a product would be set at. And this also differs for different people within a population depending on how much disposable income they have in their pockets. So what's happened with minimum unit price in the 12 years since the NICE guidance was published? Well, in 2014, England and Wales banned alcohol sold below cost price, which is essentially duty plus VAT. But I've given a bullet here just to illustrate what that means in price terms. So duty plus VAT on a bottle of vodka with a strength of 37.5% ABV, that would be about £8.72. But if you have a minimum unit price of 50 pence per unit, as recommended in the NICE guidance, the comparable price there would be £13.13. So there's a bit of a difference depending on whether you go for a price measure such as duty plus VAT, or if you go to minimum unit price per se. In 2012, the UK coalition government was quite supportive of the idea of minimum unit price. David Cameron made some very warm statements about being guided by evidence in terms of policy for public health. Nevertheless, when we moved to a majority government, that situation changed, and the Conservative government at the time withdrew its support to move forward with the minimum unit price in England. Things are quite different in Scotland. There was legislation to have a minimum unit price of 50 pence per unit, and this was passed in 2012. As many people on this call will know, that decision was challenged by the Scottish Whisky Association, and it was referred to the European Court of Justice. It took a little time, but that case came back to the Scottish courts, where they were asked to investigate how proportionate it was and whether the aims of minimum unit price could be met by general tax increases. And it was concluded that minimum unit price did not contravene EU law, that it was proportionate, and that it was highly likely to be very targeted, and an appeal about that judgment was not upheld. So Scotland moved forward to introduce a minimum unit price in 2018, but with the sunset clause. And that clause meant that there needed to be a vote to continue with the minimum unit price approach in Scotland after a 6-year time point. And there is a comprehensive evaluation ongoing across Scotland to look at all the impacts of minimum unit price in that jurisdiction. Wales introduced minimum unit price in March 2020, and bringing things bang up to date, the Republic of Ireland introduced just last week a minimum unit price in Ireland on the 4th of January. So as we know, and we can see by the different directions that are taken in England, Scotland, Wales and the Republic of Ireland, there can be a tension between evidence and policy. And this topic was investigated by Vital Katiki-Reddy from Glasgow University and published in 2014. And some of the things that are presented in terms of this tension is that to some views, a lot of the modelling work that minimum unit price was initially predicated upon, to some views, it doesn't represent the real world. In inverted commas, some think that it's sort of, it's made up because various assumptions and parameters are put into these sorts of models. It's also been said that minimum unit price can affect people who are not problem drinkers because it will have effect across the whole of the population. The media in particular picked up the idea that minimum unit price might affect less affluent people, more than people who've got more money in their pockets. There have been views that suggest that producers might benefit from general raised prices, that governments could benefit from raised duties from alcohol revenues that come in, and that some industries may benefit from the minimum unit price and some might be harmed through this. And all of these have sort of militated against the introduction of minimum unit prices in some areas. Yet other countries have decided that the harms linked to alcohol consumption not only fall upon the drinkers, but they fall on a wide variety of other people who can be affected by alcohol. And taking a balanced approach to public health requires you to think about both groups of individuals. There's also a significant cost to the NHS and to other public sector services from alcohol health harms, and also to the wider economy. So for the rest of the talk today, I'm going to now introduce some of the evidence that we've gathered. This is empirical evidence where we've actually looked at the impacts of minimum unit price. Now it's been introduced in Scotland and then in Wales, and we're in a position to be able to compare those effects against the situation in England because minimum unit price hasn't been looked at there. I'm going to focus primarily on 3 pieces of work. The first one, which was published in the BMJ in 2019, led by Amy O'Donnell, was essentially looking at the immediate impact of minimum unit price on alcohol prices and purchases in Scotland, and that work went up to 9 months. The second paper in 2021 looked at the situation in Scotland at 2 years, but also was able to bring in the situation in Wales because we were able to address the immediate impacts in Wales. And then some work that's going to be published very soon, I think it's next week or the week after, which is looking at the differential impact of minimum unit price in Scottish men and women, looking to see how this policy is having an impact on different parts of the population. There's 2 pieces of work that may come up in questions and answers, but I won't go over them in any detail. The first was published in Alcohol and Alcoholism, looking at the impact of the COVID-19 lockdown on alcohol consumption across the population. And so there's been a little bit of work that we've done, which will come out next week, which is looking at some of the different messages that come out when you look at what people buy in terms of alcohol and what the tax and revenue data show, but also what people report in surveys and what mortality data around alcohol are showing. And we posit that there is now a new paradox linked to the COVID-19 pandemic, where we have different pictures of alcohol health harms depending on which data you look at. So moving us forward, I'm going to first look at price and purchase behaviour. And for this work, we use Kantar World Panelled Household Shopping Data. This is essentially the data that's collected on British households. KWP has 30,000 British households at any one time. And these households are recruited via stratified sampling, where targets are set to achieve a sample that covers regions, household size, a particular age of shoppers and different occupational groups. And people are given high street vouchers for completing this household shopping data activity, because it's really quite intensive. The households provide their demographic information when they join the panel, and they update that every year. But they also record all the purchases they make from all stores that are brought into their homes. They have to use barcode scanners and upload digital receipts in order that what's in the barcodes can be verified. The households have to meet quality control criteria monthly, and this is for the quality of the recording of the data and also the amounts that they're buying from different store types. The households essentially report the age of the main shopper, the number of adults in the house, the household income, and details to do with social class and life stage. And we use continuous data for our first work from 2015 through 2018. And later on, I'll report some data looking at what the situation is in 2020, up to July of 2020, although we didn't have the data for 2019. And some of the key variables in this work, we're looking at the alcohol-specific purchases that people make and the prices that they pay for the alcohol that they buy. These data are recorded daily, and they include non-alcoholic and low alcohol products as well. There are product descriptions which identify the type and the amounts of alcohol that are bought, and these fall into 19 different drink categories, but there's details on the brand, the cost, and whether any purchases were bought on a price promotion. The alcohol by volume is usually included in the product description in 98% of the time, but for about less than 2% of purchases where there was no alcohol by volume information, we were able to use those 19 drink categories in order to estimate what was in those products that were bought. The volume was combined with the strength in order to calculate the grams of alcohol purchased, and we were interested in how much households were spending on alcohol. And the data were prepared for interrupted time series analyses by adding up weekly records and aggregating them, adding daily records and aggregating them weekly. We looked at this across all households for the 208 weeks in the sample. And in Scotland, minimum unit price came in week 174 out of 208. We had a longer time frame, as I've said, in the later papers, and we're looking at means per household for every week. Some of the key subgroups that we're interested in, we used ONS classifications and truncated postcodes to try to figure out where people were coming from. And we were able to group households into Scotland and England and later into Wales. For some of our analyses for robustness checks and sensitivity analyses, we considered different bits of England. And certainly in the initial paper, we looked at the border of England, where people live close to the Scottish border, because we were looking to see if there were any cross-border effects. And here we were looking at places in the northeast and northwest of England. For later work, we looked at West England to make some comparisons with Wales, and we were interested in the northwest, southwest, and West Midlands. But for some later work that I'll present on consumption, we looked at the whole of the north of England, and here we had northeast, northwest, Yorkshire and Humber. We were interested in household groupings. Any age-based analyses were focused on the age of the main shopper. We had 5 social class groups based on a national readership survey, which really looks at occupation and media use, and it's a non-income based measure of social class, but we also looked at household incomes, and the households were divided into 5 quintiles. And we looked at 5 consumption groups, again, quintiles based on consumption level. And in our analyses, we were essentially doing interrupted time series focused on the natural experiment of introducing minimum unit price in May for Scotland 2018 and later in Wales in March 2020. And for interrupted time series, essentially this is looking at what happens over time for particular sort of things that we might be interested in. And if we'd done a single interrupted time series where we only looked at things that were happening in Scotland, you need to make some assumptions. And that is that there is a sort of a trend of what happens over time. And this can be affected if you introduce an intervention such as a policy measure like minimum unit price. But you need to make an assumption that the data would follow the same trends as you could originally see if the intervention hadn't been introduced. But these trends can be affected by all sorts of external factors to do with sporting programs or politics or even bad runs of weather. So it's actually these time trends, the data can be knocked off, of course, by all sorts of external factors, and it's a stronger design if you're able to, is to take a controlled interrupted time series approach. And this is to look at what happens in one place compared to another place that's very similar to it. So the samples are broadly similar, but the only thing that substantively changes is the introduction or not of a measure such as minimum unit price. There are some assumptions made here that the level and the trend in the group exposed to the intervention, here it's minimum unit price, would have stayed the same as the control group if that intervention hadn't been introduced. And so there can be these secular or external sort of changes that happen, but you would expect those external factors to affect both groups. And here you're really singling out the introduction of a specific policy like minimum unit price. So moving us forward, the sample for the O'Donnell paper in 2019, we had about 0.29 million purchases from over 5,000 households in Scotland, a lot more households in the whole of England, and 0.58 million purchases and from 10,000 households in the border part of Northern England. When we looked at the samples, the Scottish households had a slightly lower weekly household income than their English counterparts and a slightly higher proportion of people who were from the lower social grades based on the readership survey. They were more similar to England border places. But the Scottish households in the Kantar data set had similar characteristics to the national population of Scotland, except there were slightly more single households in the Kantar data set. But the distribution of the characteristics in households was similar across all of the weeks in our analysis. And in terms of presenting our findings, we're looking at these time trends before and after minimum unit price was introduced. We're showing regression coefficients with 95% confidence intervals. And these are mean changes in our dependent variables due to minimum unit price. We've got some data where we're looking at percentage changes. So we're able to calculate these from our baseline things, our baseline data on price and purchases. We did sensitivity and robustness analysis looking at Northern England for Scotland and only drinking households. And then the later paper focused on Scotland versus Northern Ireland and Wales versus Western England. But a key feature is that all of the data I'm going to present were the country of interest minus the English data. This helps us have a visual simplicity in our presentation, but it means that all the findings that I'm going to show to you are all differences. So these are findings that show what's happening in Scotland over and above any changes that might be occurring in England. And so the first findings we have here is the top graph is looking at the price per gram of alcohol in Scotland minus what the price was in England. And what you can see running along all of the weeks up to week 174 are the data there. The dark line is the time point at which minimum unit price was introduced. And what you can see for prices after that introduction, there was an increase in the average price alcohol products in Scotland, and this was essentially just about an 8% increase in price in Scotland, and that was 64 pence per gram. And I've got the confidence intervals there as well. The second graph shows the amounts of alcohol that were bought in grams, and again we're looking at Scotland in a situation minus what was happening in England, and you can see that after the introduction of minimum unit price, which is that dark line, there's a 7.6% drop in purchases of alcohol, and that's about 9.5 grams of alcohol per adult per household per week. Looking at the impact by household type, these are the coefficients for the changes in firstly on the left in price per gram of alcohol purchased. And it's perhaps not a surprise when you look at these data that you're sort of seeing a slightly, the data on the left-hand stack are essentially households by purchasing fifths. So these go from the lower purchasing households to the higher purchasing households. And what you can see that in price terms, there's slightly more of an impact on alcohol, on households that buy more alcohol. And the second stack on the left-hand graph is looking at households by income quintiles. And what we see here is that there is slightly more impact in terms of the price effects on the lower income households, and these will be the households that are more likely to have been buying the lower price alcohol sort of products. When we look at the changes in grams of alcohol purchased away from price here, what you find is that there is a much striking effect essentially on those households that are buying the most alcohol. And that's, I don't think you can see my cursor, so you're going to have to take your eye to the right-hand pair of graphs, but that's the left-hand side of that graph. And then when we look at household income quintiles, essentially it's a slightly different, slightly more complex pattern to follow there, but it seems to be having the least effect on the most affluent households, as we would expect, because these are the households less likely to be buying the cheaper forms of alcohol. Moving us along with my lazy mouse, this is a key figure, I think. So this is essentially household expenditure. So how much alcohol is being bought at the price that people are paying for it. And looking at the left-hand side, essentially this is the change in weekly expenditure in households, depending on how much alcohol they're buying, from the lower purchasing households to the higher purchasing households. So where households buy more alcohol, it's having they're having much more of a kind of price, so an expenditure impact. And then when we look at the income in the household, what this is, again, there's not much difference across the four lower income groups, but when you look at the highest income group, they are least affected. And again, as I've said, this is because they're least likely to have been buying the cheaper forms of alcohol. So I'm going to move us to the longer term picture. I'm not going to go through all the method because I've essentially given you that. But the left-hand graph here shows you data from the Anderson et al. Paper in 2021. And this is the picture in Scotland up to 2 years. If you look at the red line, what you can see is the average price per gram in Scotland from 2015 right through into 2020. There is a gap. I may have omitted to say that we didn't have 2019 data, so there is a pause there. But what you can see is follow essentially what happened to price when the minimum unit price policy was introduced in 2018. The second red line is a line that denotes the COVID lockdown on the 26th of March 2020. And we wanted to have a look in this paper to see whether we felt the COVID lockdown had any impact on things. If you follow the blue line, what you can see is the amounts of alcohol being purchased in terms of grams, and what you can see is following the introduction of minimum unit price, there was a reduction in the grams of alcohol purchased in Scotland. And then when we look at around the COVID line, no obvious impact of the COVID confinement. The graph on the right hand side is the situation in Wales. We've got fewer data here because the policy was introduced in March 2020, and then the COVID lockdown happened halfway through March in 2020. When we're looking at these daily data, again, if you follow it in terms of price in red, you can see that there was an increase in the average price of alcohol products following the introduction of minimum unit price. There was what looks like a reflection in the opposite direction for grams of alcohol, and you can't see any clear effect of the COVID lockdown on the profile there. What does this mean? Well, in Scotland, the price increases and the decreases in purchases were maintained from 9 months and at 2 years. In Wales, the initial introduction of minimum unit price provided findings that were broadly similar in shape and also by degree to Scotland. The differences between Scotland and England were essentially of a 7% increase, an 8% increase in price, and essentially nearly an 8% decrease in purchased alcohol in terms of grams. And the data for Wales are quite similar in terms of an 8.2% increase in price and an 8.6% decrease in purchases of alcohol products in Wales. And we didn't think that these changes seemed to be significantly affected by COVID confinement. The changes were not significant in our analyses. So I'm now going to switch, because the previous data that I've presented, and I need to speed up a little, essentially were for how much people might pay for alcohol and what did they buy. But what people buy doesn't always translate into what they drink. And it doesn't tell you much about consumption across different people in a household. So we were able to use some data from Kantar's AlcoVision survey here. This is continuous retrospective online diaries, which capture the consumption of people in the previous week to when they complete these diaries. There's an annual sample of 30,000 individuals who are 18 or over in Great Britain. The participants provide detailed data on all drinking occasions in the last week, the brands that they drink, how much of it they drink, and whether they drink on or off trade. This is something we couldn't look at in the previous analyses because we only had off trade data. Participants complete the survey only once, so these are not repeated surveys. There are quotas set for the AlcoVision sort of panel, and each day of the year is represented in the data. So it's a monumental effort to invite and get completions from participants so that each day of the year is represented in the data. There are weights based on age, sex group, social grade and region. And Kantar, at the customer request, oversamples residents from Scotland and younger individuals from England and Scotland. So they're not exactly nationally representative data. The key variables here we were looking at are people's reported consumption of alcohol in the previous week, allowing us to look at mean grams of all alcohol per week separately for men and for women, and we could parse this by different types of alcohol. We were also able to look at the consumption that was reported linked to both off-trade, which is generally products bought for consumption in home, but also on-trade, which is where people are buying alcohol in pubs and restaurants and bars, and this is both by men and by women. These data are reported in Jürgen Reem's paper, which is, as I said, coming out quite soon. We had diaries for essentially 50,000 women and 50,000 men. There were an average of 512 diaries each week, and this was a stable rate over the 4 period of data that we had. There were some minor differences for Scotland and England in terms of the sample composition, but these were similar before and after the minimum unit price policy introduction, except for women. And what we found is that Scottish women in this data set were slightly younger than English women before minimum unit price and a little bit older after minimum unit price. And our analysis is able really just to look at immediate effects of the minimum unit price policy introduction on reported consumption and not any longer term effects. So this first graph essentially shows you what people were reporting in terms of what they were drinking in the previous week over this time period of 2015 to 2018. And the dark line shows you the time point at which minimum unit price was introduced. And the red line shows you the total alcohol that was consumed, and then green is the off-trade consumption and blue is on-trade consumption. And then this graph is slightly complicated, but it just shows you the associated changes in consumption following minimum unit price. It continues to be Scotland minus England. So these are means with associated confidence intervals, but we've distributed the data on essentially looking at consumption level, and we've broken it down into percentiles. And what you can see is that the lower levels of consumption, there's very sort of little, there's essentially not a lot of change going on. What you find is that in areas of consumption that are in the sort of intermediate sort of levels, you're seeing quite a bit of change, particularly in the women, if you follow the solid red line there, compared to men. But then if you look at the very highest levels of consumption, the 95% percentile, what you're seeing there is some increases in consumption following the introduction of minimum unit price. And these slightly complex graphs are just really starting to look into what might be happening on the basis of the age groups of people who are contributing these diary data, and also in terms of income quintiles. If we look on the left-hand side to begin with and just look at all consumption, essentially what this is suggesting is that we're tending to see decreases in consumption, particularly as people become a little older in the sample, but there's something around the younger age groups where there is reported increased alcohol consumption in men, who are here in blue, in the youngest age group. For women, it's not quite so clear-cut there. And the following two graphs, looking at consumption by age, are just looking at the consumption where alcohol's bought off-trade and where alcohol's bought on-trade. And there is really something around the younger age groups that we need to think about for men here, particularly in terms of off-trade consumption. When we look at the deprivation quintiles, and here it's important to realise that the lowest income households are on the left of these graphs, going up to the highest income households. And the first graph is showing in blue for men, the consumption that is reported, and then in red for women. And certainly in the lowest income household, there is something very much about women, where we, I think this draws our eye for attention for further analyses, looking at the potential for increased consumption in women in some of the kind of lowest income households. And the other graphs are just showing these data cut by off-trade and on-trade consumption, and they become a little complex and a little harder to follow. But I want to sort of finish with this graph, which is essentially showing change in consumption. This is in grams per week. It's associated with the introduction of minimum unit price in Scotland, but controlling for the changes in England. And what we've done here is we've just plotted things by each age in terms of year for men and then for women. So you can see where people fall in terms of plots from the very youngest men to older men, and then on the right hand side for the youngest women to older women in our samples. And what you can see at the lower end of the age distribution, you've got sort of sense that men essentially had the potential to increase their consumption following the introduction of minimum unit price, and essentially it draws our eye to thinking about what's happening in terms of on and off trade here. Women seem to be more responsive to the minimum unit price policy introduction, although as women get older, we're starting to see that perhaps the on-trade consumption of alcohol, that's somewhere that seems to be least responsive to change compared to alcohol bought in the off-trade. So I think I've used quite a lot of my time, and I'm going to try and conclude relatively quickly. I think our data are showing that minimum unit price seems to have had the effect on price and alcohol purchases as predicted by modelling. The decreases in purchases seem to be somewhat greater than the UK model estimates first predicted. There is a fit with some of the evidence from Canada and from Australia, where minimum unit prices had a particular effect on cask wine production. The effects of minimum unit price seem to be sustained in Scotland at 2 years, and we found an immediate similar size of effect in Wales at around about 4 months. We didn't see any obvious impact of the early COVID confinement or lockdown that happened to households. There seems to be in the data a clear sign that minimum unit price has most effect on households that buy the most alcohol. But the effect on lower income households is complex, and that's because households with less income tended before the introduction of this policy to be more likely to buy the lower cost alcohol and potentially higher strength alcohol. But we really need here to look at expenditure. And that's not just what is the price that people are buying products for, but how much are they buying at the price they buy it for. And I think the later data that I presented provides some concern about the total accuracy of targeting. It seems to be that women appear more responsive than men, but we may need to think about additional measures focused particularly on younger men and the heaviest drinkers. So I think I'll stop there. I have got a little evidence from elsewhere, but I think we'll just pass by there, and some references from the data I presented to you, which we'll make available next week following the lifting of the embargo on one of the papers that I've mentioned.
Okay, thank you very much, Eileen. That's a fantastic summary of some really complex concepts. I mean, interrupted time series, my brain tends to go into freeze mode, and I think I understand it a lot better than I did before, but don't ask me any questions. Okay, so time now for questions, and some have already come in. Can I just quickly ask the team, can I ask people to give them themselves, or is it best if I read them out?
You can ask people.
Because Alison Douglas, Alcohol Focus Scotland, had an early point about the percentage of abstainers. Alison.
Thanks, Ian. Thanks, Eileen. That was a fantastic presentation. There's so much in there. But it was just your very introductory slides around the kind of breakdown of alcohol dependent and through to abstainers. And I saw that you had 40% abstainers, and I was just kind of curious about that percentage, because First Health Survey reporting is very much lower than that at 17%. Thanks.
Yeah, Alison, thank you for that. I used that image just as a sort of to help exemplify my point on the slide. It's not come from our data; it's come from an online source. And when I looked at it, I felt that proportion of abstainers was too high for the figures that I would generally sort of see. It is, though, a situation that is in dynamic flux, because the proportions of people who are choosing not to use alcohol are changing all the time. They've changed quite a bit as ethnicity alters, as particularly young people are making different choices about use of alcohol. So I didn't put in my bullets the particular percentages there, because I felt it was a little bit too high. So perhaps for the future, I might take out that particular visual sort of guide. But I would say it's lower than 40%. What I would generally say is that we have about 15% of never drinkers, but yet we have a population where some people choose at different stages of their life to stop drinking, and that's not just because they've experienced problems. They're just taking different health behavior choices and wanting to maximize health. And I think in the COVID pandemic, we have seen some people trying to take steps to increase general health because of anxieties to do with the COVID pandemic.
Great, thanks. I think I'll just read Sinead Anderson's question out, because it's a very short factual one. Why wasn't consumption data available in 2019?
I think, again, this is disruption to do with the COVID pandemic. I think essentially the data, Kantar data available from a market research company, Peter Anderson applied and were given access to those data. And essentially during late 2019 into early 2020, essentially the pandemic hit all of us and also hit the market research companies. So we just did not have access to those data.
Am I right in thinking that Kantar data is quite expensive to access, that you have to pay?
Yes, generally you do.
And so when you move then to Kantar World Panel's AlcoVision data, are those focused purely on alcohol, and are they cheaper to access than getting stuff on shredded wheat and cornflakes in there that perhaps you don't necessarily want?
Yeah, no. I don't know about the relative cost of the diary data and the market research data, but they can be expensive to access, and there can be a time delay in accessing them.
Okay. Sadie Boniface from the Institute of Alcohol Studies has got a question. Sadie?
Hi, thanks, Ian. Hi, Eileen. Yeah, my question, quite a simple one, really. I just wondered if you had any more studies planned for looking at Scotland and Wales to see how the effect holds up over time.
I think that one, I don't know the answer to that, and it's partly to do with my own sense of busyness. I have to say, before, I'm delighted to give this talk to AHA and for Ian, but as we've all said, these are complex data, and I am not the sharpest pencil in the box when it comes to the statistical analyses. Essentially, we have got some more data coming out, and I mentioned this, to do with the COVID pandemic, because there is a bit of a discrepancy in terms of what happens when you look at what people are buying in the pandemic. We have published one paper in Alcohol and Alcoholism that shows that at first look, in the pandemic, people seem to be buying more alcohol from supermarkets. But when you factor in what people have bought in the past from pubs, clubs and bars, there isn't a significant difference. And the tax revenue data sort of back that up. But nevertheless, if you look at surveys and if you look at alcohol attributable deaths, there is a real contradiction there. And we think that the explanation for that contradiction lies in the fact that there are subgroups within groups. And where we're looking at, for instance, some of the lower socioeconomic status groups, you've got real extremities in those groups. You've got a higher proportion of people who tend not to drink, some never, and some just choose now not to drink. But you've also got groups of individuals in there who have some of the highest levels of alcohol consumption. And Sadie, I think you might have been linked to the Dan Lua paper that we published, where we looked at extremities of alcohol consumption in the lower socioeconomic status groups, way beyond those thresholds of low or high risk. And so that group it's got lots of different kinds of people in it. And we don't often look in a fine enough grained way there. So I think there's something important about the groups that buy a lot of alcohol and the groups of people who drink at very, very high levels. And they can find themselves in a group with other people that they are quite dissimilar to.
I mean, that's
so the first answer is pass, and the second answer is watch this space next week for the COVID alcohol specific paradox.
It's interesting because the question I often get asked, and I think I got asked it on Radio 4 this morning, was, you know, alcoholics are going to drink anyway. Why would they be affected by minimum unit price? You know, they're addicted, they need it, they're going to drink it. And I thought in your percentile distribution of consumption graphs and the RAIM first author ones, it looked as if at that extreme right end that there was little change in consumption brought about by MUP in the very heaviest drinkers.
We did not have the ability to determine whether anyone was experiencing alcohol dependence. That would be relief drinking when you know in mornings or withdrawal symptoms. But this is being looked at. Yeah. So in terms of heavy consumption, some people can function at high levels and manage well. But the Scottish government has commissioned work where they're particularly looking at the heavy drinking groups and people who are alcohol dependent and would find themselves into treatment samples. I know that the Scottish government has been excellent in presenting its findings as they go and making them available in the public domain. But it is clear that there will be different kinds of responses to minimum unit price in different sectors of the population, and that people who've got a degree of alcohol dependence are likely to need a lot more support than just a whole population policy level measure. This primes the population, but there is a need for care and attention for people at the heaviest drinking ends of the spectrum.
I think I'm going to have to apologise to a lot of very eminent people who've asked questions that we're not going to have time to pick up. But if we can maybe pass them through to you together with the name of the person that asked them, Eileen, maybe you could respond to one or two of them.
If anybody wanted to stay on after 3 o'clock, I can stay for a little while.
That's very kind of you. I think I've certainly got to go at 3 for another meeting, and some others I think probably will. So, yeah. But it's a kind offer. I'll just maybe finish then with one from Sarah Schoenberg of the AHA, who says, given the evidence that we've now got, how would you try to get the UK government to accept minimum unit price?
This is a bit of a live question, isn't it? Well, I think that the evidence is now here for the English government to focus upon. I think the English government had a degree of caution, an over degree of caution, because they wanted empirical evidence to persuade them of the impact of this policy and a targeted impact of this policy. And I believe that we provided that information to them. But I've also said that people take different approaches in policy terms. And I think some of the kind of media coverage this week, it also shows that we still have got a complex relationship with alcohol across the UK and particularly in England. And so I would just hope that the English government is able to look at the evidence that they've asked for and then make decisions to actually help to promote population health based upon it.
Okay, I mean, on Radio 4 this morning, they made great play of the fact they were bringing in this change in volumetric application of duty, but they had a case study on of a man who died of cirrhosis after drinking Strongbow cider, and we were able to show that actually Strongbow cider would have been actually cheaper in real terms after the government's new volumetric changes.
Yes, I mean, I think I've covered a lot of ground, perhaps too much for the audience, but just to say that in the particular papers, there is an indication that the minimum unit price in Scotland had a specific impact on cider. Yeah.
Interesting. Okay, well, it is exactly 3 o'clock, and I think one of our principles in these seminars has been keep to time because everyone's very busy, but we would be delighted if you could have a look at those questions. I think you'll know quite a lot of the people who've asked them, and maybe hope it'll lead to some more interesting research. There's certainly a lot of questions being thrown up as well as answers, and that's the hallmark of good research. So Eileen, on behalf of the AHA, many thanks for giving up your time for that really interesting and educative presentation. Thank you, everybody, for attending.
Meg,